Anne O'Donnell. I'm a dentist, been a dentist for quite a while, and I have a huge interest in sleep medicine for adults and in early orthodontics for children. So obviously with the sleep medicine, that brings in sleep apnea testing, appliances and mouth tape if needed. For the early intervention for children, starts with mouth breathing. So if you want to get a good result, you need to change the mouth breathing. So that's where we start and get the children actually breathing properly.
Well, as a dentist, what would be the negative effects you see, not just in mouth breathing in children, but also leading into adulthood? And what negative impacts can mouth breathing have, especially at night, on your dental hygiene?
Well, if you mouth breathe, obviously your mouth is open, and that means naturally at night your saliva flow reduces anyway. But if you've got your mouth open, then you've got a really dry mouth. So actually often one of the signs we see in the surgery is if somebody's got a lot of inflammation in the front of their mouth and not so much at the back, that's literally because their mouth is open. They've no protection from saliva at night time, so they're getting that. The bacteria are literally having a field day because there's no protection.
So for people who don't know, when your mouth dries out and you don't have that saliva, what role does the saliva play in you having good dental hygiene or protecting your teeth?
The saliva produces minerals like calcium and phosphate and allows those to go between the tooth. People think the tooth is a solid structure, but it's actually minerals moving back and forth. So if you don't have the saliva, then the bacteria are going to be producing acid. That's able to take out calcium and phosphate out of the tooth. If you've no saliva to replace that, then that's where cavities start.
Okay, so would you notice that people who mouth breathe would be more susceptible to having cavities?
That's another, yes, yeah. And the inflammation I spoke about first would be then they're more likely to have gum disease, and they're going to have inflammation, and that's what starts that whole, then that inflammatory response throughout the whole body. So it's really important. This is where to stop it.
Okay.
Yeah.
Sometimes when people wake up and they're heavy mouth breathers, they can often notice that they have bad breath in the morning. We also know that your breath and dentistry are very linked. So would you say that your breath would have that, I don't know, smell worse if you're mouth breathing at night, or what's that caused by? Just curious.
The same thing. So less saliva protecting, because saliva is also antibacterial. Less saliva, bacteria have a field day. Bacteria produce compounds with sulfur, smell. So you're going to have bad breath in the morning.
Okay. Yeah. So yourself, is there anything you use to maybe stop mouth breathing at night, and that can also yield some benefits to your oral hygiene and dental health? So
actually, even myself, I actually use these tapes now. I don't mouth breathe all the time, but what I would do is I go asleep, nasal breathing, and then some stage during the night I did switch over to mouth breathing, and then I'd wake up with the wide open mouth. So I use these at night time, and it just, I actually have, this is a smartwatch, and the results with the nasal breathing is just incredible. Much better deep sleep and a longer sleep as well.
Okay.
Yeah.
Very good. And
so that's for myself. So obviously then I do the same for patients. Now, if somebody's got severe apnea, most of them need a CPAP machine.
Oh yeah, of course.
But everybody knows they're not easy to comply with. So if you really can't wear it, you could consider this, and then redo a sleep test and see how you're performing. If you've got mild to moderate, then you could consider these, or get a mandibular device. So this is the mouth tape. So you literally just take the adhesive off the back, just give a little wash around your mouth and stick this on. And that's it, you're done for the night.
What was your own personal experience using mouth tape? When did you begin mouth taping?
I only began a couple of months ago, and I have to admit the first night or two I did end up waking at some stage and kind of take it off. But now it's just automatic, and I haven't removed one. It's
very good.
Yeah, perfect. And I've probably gone to sleep the odd night without it, but it's part of my routine now.
And how do you find the tape itself? Is it stretchy?
There's a nice give in it. Now, and I even find that if I really wanted, I can just peel the corner, and if I have a little cough or something, and just stick it back again. And it hasn't affected my skin or anything like either as well. So I'm really happy with them. Yeah, they're really good.
Perfect. What would you say to somebody who's maybe on the fence and they haven't tried before, and they think, oh, if I take my mouth at night, I won't be able to breathe?
Oh, well, that's what your nose is for. Yeah, so you need to start breathing through your nose. I was at a course in London, dental course, about 7 or 8 years ago, and the dentist giving it was about 72. He looked about 40. So at the first break, we said, "How do you look so well?" And he said, "Nasal breathing."
Really, yeah?
Yeah. And he used to do the Himalayas, and he said, start out first day, he said, Sherpas all nasal breathe, and all these really fit people were there, and they were all tearing up the mountain, mouth breathing. And he said himself and the Sherpas were nasal breathing from the start, and they passed them all out halfway up. Yeah.
Very good.
Yeah.
Just on earlier, you were speaking about children and sleeping with their mouth open. I was wondering, is there any link between orthodontics and mouth breathing, as in?
Yes, yeah, because if you're mouth breathing, your tongue then is, if you breathe through your nose, a child breathes through their nose, they'll close their mouth obviously, and the tongue goes up to the roof of their mouth, and the tongue is a very powerful muscle, so it'll actually spread out the palate a little bit. But if you're nasal breathing, then your palate will stay narrow. The tongue will come forward, it'll actually push the top and bottom teeth apart, so child looks, we call it a tongue thrust, but the top and bottom teeth don't meet properly, and they've got this narrow arch then as well. So for orthodontics, to try and get those teeth back into position, you're not just trying to get the teeth in position, you're trying to get the whole mouth reshaped. Very difficult later on. So much easier to get the child mouth breathing early, get the structures into the right place, and you can actually see dramatic results pretty quickly.
For teeth alignment?
Teeth alignment, yeah.
Okay.
Now sometimes we combine that with a little appliance, and the appliance might actually encourage them to put their tongue to the roof of their mouth as well. Now, obviously for a child, I would always say, rather than going straight to mouth breathing, which could be a little bit scary, or to mouth taping, to maybe just use it while they're watching TV or while they're doing their homework, so they're awake and they don't panic with it on. And then when they're quite comfortable with it, then put it on at night time.
Very good. We often hear people talk about jaw structure and mouth taping. I was wondering, what's your thoughts on that?
Well, again, it's helping the jaw develop. So what's happened nowadays, you've got, instead of breastfeeding, people are being bottle fed, so they don't have the same forces on the jaw. Then, instead of being given kind of high fibrous foods, they're getting soft processed foods. So they're never really developing the muscles or the structures. So that's where they, at least by nasal breathing, the whole structure is being formed properly.
Very good.
Yeah.
Very good.
So if you want to save on orthodontic bills, check your child's breathing.
Yeah. Maybe invest in some mouth tape.
Yeah. It's been linked to ADHD, and I think it's probably because if a child doesn't sleep well, they're not going to perform well the next day. They're going to be scattered. I mean, any of us who have a bad night's sleep, we don't perform as well the next day. Same for a child. And literally, unless you're a huge concern, I mean, you can get their adenoids or nose checked if they're completely blocked up, and you need to do that anyway. But other than that, you've really nothing to lose by trying this. In fact, everybody could actually do with mouth taping and using it, but certainly for people who have sleep apnea or for children who are mouth breathing at the moment, it is an absolute no-brainer to start.